Good day to all of you. Good morning, good afternoon, good evening. My name is Tineke Oenema, and we will be waiting for a few more participants to join, and then we will start the webinar. Good morning, good afternoon, good evening, wherever you are around the world. Dear colleagues, dear representatives from county governments, Ministry of Health, Ministry of Education, colleagues from UN agencies, NGOs, young people, on behalf of the Nutrition for Growth Summit, the Department of Nutrition and Food Safety of WHO and the UNICEF Nutrition section of the program group, I'd like to welcome you to this side event. As we prepare for the Nutrition for Growth Summit in December, today is the last session out of 8 sessions this week in the Health Talk series WHO and UNICEF hosted this week. And the webinars focused on improving nutrition through a multi-system approach. My name is Tineke Oenema. I am the Executive Secretary of UN Nutrition, and I'm very pleased to be moderating this webinar this afternoon, today. Please note, I'm very pleased to say that there is interpretation available in Spanish, French, Russian, and Arabic. And you can go to the bottom of your screen, click on interpretation, that's the little globe there, and click the language that you would like to hear. Well, most of you, I hope, are aware that this is the United Nations Decade of Action on Nutrition. And you also know that we just came out of the UN Food System Summit, and now the time has come to accelerate, to up our game, to collaborate, to co-create solutions to improve the nutrition of children, especially the ones which have been missing from the global conversation so far, children in school-aged years and adolescents. Schools are a key setting for preventing malnutrition in this age group, which otherwise has long-term physical, social, mental, and economic consequences. Before we get started with this webinar, I'd like to let everyone know that this session is being recorded and will be shared on the One Health website. There will also be a Q&A session a bit towards the end of the webinar, and I'd like to encourage you to submit questions for the speakers in the Q&A tab. Please be sure to indicate to whom your question is addressed. Also, please upvote any of your favorite questions, because time might be limited, and then we will try to address the most favorite questions. Of course, panelists will also try to answer as many questions already through the Q&A box. Okay, let me get a little bit, provide you with some background information before we start. You can see from this slide that of all children in the school-aged age, it's 124 million are obese, which is up from 11 million in when I was a kid, basically. So that's more than tenfold. That's bad. And then we can also see that more than half of children in that same age category, 15 to 90 years in South Asia, suffer from anemia. And then again, almost 200 million children and adolescents from 5 to 19 are too thin for their age. So the challenge is enormous. Then the other slide I'd like to show you is that shows you the results of the global health surveys in countries. Maybe you can move to the next slide. Yes, thanks. That basically show you about lifestyle and dietary habits of children. And you can see that the percentage of children with inadequate intake of fruits and vegetables, or who are consuming fast food at least once a week, or drink sodas at least once per day. And you can see that these unhealthy dietary habits are prevalent across the different regions in Africa, Asia, Latin America, and Oceania. Different regions are color-coded: Africa green, Asia blue, Latin America orange, and Oceania purplish. So I think this provides you with some good background information and sets the scene for this, about the challenge we are facing with regard to school-age children. And then, apart from what we already saw in the slides, we now also have, as we are all aware, the COVID-19 pandemic. And that has shown us that school closures have impacted learning and socialization among children. It caused disruptions in basic health services and nutrition services, which has resulted in so many children and adolescents missing preventive interventions such as iron and folic acid supplementation, deworming, and other services. But it also limited children's access to nutrition and safe school meals because simply of school closures. So therefore today, more than ever, we need those bold and smart commitment from countries, from leaders, from policymakers and other leaders to ensure nutrition for all children in all contexts. We need commitment from all of you. And I'm glad that you now have joined this event, even though it's virtual, and we look forward to your contributions during this webinar. So let me walk you through the agenda. The main objective basically is to hear and learn and exchange ideas with you, how to implement comprehensive policies to improve the nutrition of school-age children and adolescents. First of all, we will hear from Lynette Neufeld. We go back so many years, Lynette, and you are such a nutrition champion. We will hear about the upcoming Lancet series on adolescent nutrition. I would say that's long been awaited for. Then we will hear from 4 different countries, Ghana, India, Dominican Republic, and Brazil, on various approaches to prevent all forms of malnutrition among school-age children and adolescents, and to ensure healthy, safe, and sustainable school food. The country presentations will be followed by a Q&A session on country-level commitments, and definitely we'll want to hear from you, the participants, to get your insights and to hear your questions. Also today, I'm very happy to be working with a youth advocate who will provide us with her perspective on why and how governments can engage with right holders, namely the young people, to accelerate efforts to improve nutrition and healthy food in schools. And of course, we cannot end this webinar without having representation from the education community. And I'm so happy to have Lisbeth Steer with us from the Global Education Forum. We look so much forward to hear from her. Okay, so I referred already to the Q&A. So please, can I remind you to use the Q&A function to pose questions to our presenters, and then we can either answer those live or start answering those in the Q&A as well. Well, it's time to start. So please, Dr. Lynette Neufeld, who is the Director of Knowledge Leadership at the Global Alliance for Improved Nutrition. Lynette, you have the floor. We're listening.
Thank you very much. So I'm going to introduce to you today the Adolescent Lancet series. I have been co-leading this together with Dr. George Patton over the past couple of years. So we're excited to start to talk about it in today. Next slide, please. As I think many of you know, adolescence has been a neglected area in nutrition. Much of the evidence that we have and the tracking of information and the research around adolescent nutrition has focused on adolescents from the perspective of their role in reproduction. Women of reproductive age are included, and that period has really focused on the implications of nutrition for pregnancy outcome and for the next generation. Extremely important, but insufficient to be focusing on in terms of adolescent nutrition. The next slide, please. Adolescents are absent from global accountability mechanisms, or they're grouped with women and children. In the anemia target, obviously there is anemia of women of reproductive age, which includes girls from 15 years of age. But the reporting is where it is reported is not disaggregated. In this case, for example, from the latest Global Nutrition Report, the indicators are grouped together with children and not presented as disaggregated by adolescents often. Can you, next slide, please? But the biological and social determinants of health and nutrition, obviously, are different, and they're highly dynamic during adolescence. They're inadequately studied and not addressed in many programmatic approaches. This is a conceptual figure of the social determinants of health that was published in the Adolescent Lancet Health series in 2016. And what you can see is that the adolescent period, shaded in gray, is highly dynamic, with changes in the influence of family, the influence of media and peers, the education system, the beginning of employment. So it's a unique period from childhood, it's unique from adulthood, but it's also dynamic in and of itself. When we speak about adolescence, we tend to speak about them as a group, but yet it's a highly, highly variable period from that 10 to 19 or the 10 to 24 age range. Next slide, please. In that same paper, the evidence for nutrition and health actions was reviewed, and basically what the group found in that 2016 summary was that the evidence for actions to address undernutrition and obesity was relatively insufficient, or if not even non-existent, for many of the types of delivery platforms that could be used to reach this age group. Next slide, please. So all of this prompted us a few years ago to bring together a group of people from around the world, including youth advocates who had been a part of that adolescent health series, to develop an adolescent series or a Lancet series on adolescent growth and nutrition. Next slide, please. The series, after an introductory paper, will include 3 substantive papers, one on the biology of adolescent growth, development, nutrition, that has been led by Dr. Shane Norris from South Africa and Edward Frangillo from the US. A second paper that will focus on food choice, which we've entitled Food Choice in Transition, Adolescent Autonomy, Agency in the Food Environment, which I have led with a large group of co-authors. And the third paper, Strategies and Interventions for Healthy Adolescent Growth, Nutrition and Development, led by Dr. Dougal Hargrave and Purnima Menon. Next slide, please. The series will call for new thinking on adolescent nutrition, with an emphasis on action as evidence emerges, and with an emphasis on young people being actively engaged in the development of the solutions that are needed to address all forms of malnutrition. The recommendations will emphasize policies and programs that respond to the diverse realities in which adolescents live, take advantage of the unique opportunities for interventions that include schools, but must go beyond schools and must address the reality of how adolescents live, including, for example, through digital platforms. It will also emphasize that these policies and programs must be underpinned by an understanding of the structural and commercial drivers of adolescent food choice, and that we must enhance investment for addressing the evidence gaps, but doing so in a way that will break the cycle of inaction that we often find given the limits and the extent of evidence that we have already around adolescent nutrition and the actions that can improve adolescent nutrition. So that's as far as I have time and scope to discuss today. The papers have been accepted, and we are in the process of planning the formal launch of the series. And please keep your eyes open. It will be launched before the end of the year, although I don't yet have a specific date and venue to announce, but it will be coming very soon. Thank you very much. And I'm happy to answer any questions if you can put them into the Q&A. Thank you.
Thanks so much, Lynette. This is really interesting. You shared your insights, and it must have been quite a challenging job. I mean, that this group, this field of knowledge is so dynamic, as you say, and there's so many gaps in the knowledge. So, in fact, I'm very much looking forward to this series. Towards the end of the year, I'll keep you to your word there. And I've been engaged in a few adolescence and nutrition workshops and webinars, but without that, consolidated body of evidence, we were discussing and sharing experiences, but not yet underpinned by the work you've been doing. So really, I'm looking forward to this much awaited series. I know you have to leave a bit early, around 3:30. So I'd like to ask you a question before you leave. What would you like to suggest to countries, government and ministries on how they could contextualize the recommendations of this upcoming Lancet series?
Yeah, that's a great question. And there is so much you will see as the series comes out. But I think what I would like to emphasize is that dietary intake is the fundamental driver of nutritional status. And we don't need to wait to know that dietary intake is not aligned currently with recommendations. So my plea would be action to improve the quality of diets of adolescents. Don't wait for more evidence of what the problems are. Find out enough about the context to know how to act, but then act and generate that evidence as we are acting. Because I think my fear is that we're caught in a trap of inaction. So light touch framing of what our challenges are in a specific context, act and generate that evidence while we're acting. Thank you.
Thanks, Lynette. I could not agree more. And you mentioned the food environment in your slide. So I would guess that that's an area where some of these commitments and actions could take place very usefully. Great, excellent. So please, people, remind Lynette is leaving, so you'll have to till 3:30 to ask your questions to Lynette in the Q&A box, and she will be available to answer them. Let's move on to our next session and hear from the various countries who are part of our panel and how they have been able to move the needle to improve the nutrition of school-age children. We've got 3 live presentations and one video, which showcases good practices and commitments from countries on how they have implemented comprehensive policies and programs and increased investments. Okay, first, I'd like to hear from Ms. Essie Amoafu, who is the Director of Nutrition Services in Ghana Health Services. Essie, the floor is yours.
Thank you very much for the opportunity. Good day and warm greetings from Accra. I will now talk about how we have been improving diet of school-age children and adolescents in Ghana. Next slide, please. Can I have the next slide? Thank you. To set the context, I'll share a few information on the nutrition situation and related determinants. And the nutrition situations, first starting with stunting. The current prevalence of stunting stands at 18%, having reduced systematically from around 30%. High as this is, I'd like to also add that there are very high disparities in terms of geographical location and wealth index. Anemia continues to be a big problem among the macronutrient malnutrition issues, and the available data shows that anemia in reproductive age women is very high, with adolescents as a group presenting with the highest prevalence. We are beginning to see an increasing trend in wasting, and as you can tell, we are actually seeing a triple burden of malnutrition as obesity in all age groups, but also in the school age child and adolescent is on the increase. Other determinants that are related is the burden of child marriage, which the data shows that 1 in 5 young children today will be married before they turn 18, and is actually slightly decreasing. There is an increasing number of school-age children who are not currently in school, and 4 in 10 women are not covered by any form of health insurance, an indication that the issue of financial risk is not adequately addressed. Teenage pregnancy is also a growing burden. Related to that are the key drivers, which include the fact that there is poor nutrition practices among adolescent and school-age children, and the growing urbanization and increasing income, as well as the changing nutrition environment, leading to increasing access to unhealthy foods, and the fact that there are inadequate policies to support change are some of the issues that is contributing to this problem. Next one, please. So for us, I will now talk about the evolution of the Ghana program, which has progressed and grown from an anemia prevention agenda to a comprehensive program that is looking at improving the quality of diet of the school age and adolescent girls and boys in Ghana. And this has progressed from an idea that was built on the existing food-based program that was focusing on anemia reduction. And it entailed bringing stakeholders together in an active process, especially focusing on the Ghana Education Service, key health and development partners, including UNICEF, WHO, CDC, USAID, COICA, and other agencies right at the beginning of implementation. And we put together a very comprehensive implementation design that entailed protocol development, behavior change communication supported by advocacy, and a very in-depth monitoring and evaluation framework that set the tone for the work that we started. And the implementation itself was phased out with a nested impact evaluation built into it, and the scale up done systematically. And today we are upscaled nationwide in all the 16 administrative regions. And this has been a very integrated system that started with the gift, which is the girls' iron and folic acid tablet distribution, and involving the procurement, which today has been taken over by government and with support from our partners. In order to sustain the gains and integrate that into service delivery, the indicators are now integrated in the Ghana Health Service data system, and discussions are ongoing to integrate that into the Ghana Education Service Delivery System as well. And the ongoing expansion is focusing on a nutrition-friendly school initiative that is more comprehensive and looking at modifying dietary practices and bringing lifestyle changes to adolescent and school children. Next one, please. On the approach, this intervention has been built on a strong partnership between the education sector and the health sector, starting with an MOU and bringing our partners on board as well to develop this comprehensive intervention, which has 4 key pillars. One that is focusing on school health and nutrition guiding principles, which actually describes actions that school authorities should agree and oversee the implementation in the schools. And creating a safe school environment that guides the activities to ensure that food environment is promoting the intake of nutritious foods and will discourage the serving or sale of unhealthy foods. And school-based delivery of health and nutrition services that is focusing on providing health and nutrition services, including the iron and folic acid that is given weekly, and where it's needed, DOMS are also provided. And finally, the 4th component is the nutrition education in school that is centered on behavior change approach for promoting optimal nutrition, sexual and reproductive health, responsibilities and rights of the adolescent child, as well as promoting healthy physical activity and hygiene and sanitation on the school compound. Next one, please.
Essie, sorry to interrupt you. You have about 1 minute left.
Right. The other approach to strengthen what has been happening is an assessment that showed some of the deficiencies that we needed to concentrate on, including what has happened as far as WASH is concerned and the kind of foods that are being sold on the school compound. Next one, please. Finally, we have put in place a lot of policy and guidelines on what we are doing. And the package of intervention includes fruit days, WASH and health inspection days, physical activity, and iron folic tablet supplementation and education. Next one, my final slide. And as you can see, these are the early wins where we are seeing changes in knowledge and access to fruits and vegetables, changes with what foods are being sold on compound of the schools, and the gift program has scaled up, reaching over 1.8 million. And we believe that some of the success factors for this have included advocacy, partnership, the tools and guidelines that have been produced, and the generation of evidence and community mobilization. I thank you for your kind attention.
Thank you, AC. I really think this was a great and very clear presentation on how you and the Ghana School Health and Nutrition Program has evolved. And also thank you for sharing those early wins. I'm almost inclined to call them low-hanging fruits, with the little girl holding the orange. So thank you for that. I really love that early wins presentation. So let's move on to India. Let's move on to Dr. Zoya Rizva to see how India is reflecting on their approach to scaling up programs to prevent anemia among school-aged children and adolescents. Dr. Zoya Rizva is the Deputy Commissioner in the Ministry of Health and Family Welfare of the Government of India. The floor is yours.
Yeah, thank you so much, and so happy to be here representing my country. Thank you for inviting India to present what we are working on to improve the micronutrient nutrition status of school-going children and adolescents. Next slide, please. Just to get some kind of background, the country of India, we handled one thing which is called the Comprehensive National Nutrition Survey way back in 2018. And this was a huge, largest survey of its kind on nutrition. It looked at 8 micronutrients deficiencies, and it covered more than 112,000 children, school children and adolescents. And we used more than 2,500 survey personnel who were trained, and then they carried out it in 30 out of the 36 states and union territories of the country. So this looked at the data on nutrition, data on the lifestyle habits, data on school going, there were group discussions. So this basic data which came out showed us that 1 in 3 children enter teens while they're still malnourished. At the age of 12, more than 40 girls are actually anemic. 1 in 5 teens, which is about 48 million for our country, face more than 3 micronutrient deficiencies. And at the age of 10 itself, about 1 million, say about 3% of our population is facing the epidemic of diabetes and hypertension. As you all may be aware that India is supposed to be the capital of hypertension and diabetes. So that is something which is really very important for us to emphasize on, especially more so because physical inactiveness is one thing which is spreading like a silent epidemic. And all of you will agree that especially during COVID lockdown, this has further added to the woes and problems of the nation. And lastly, of course, the fried food intake, which was also mentioned in the previous slide by Lynette also, is one of the surveys which she found is huge by India. 13% of our school children intake fried food every day. So these are small things which came out. I thought we will share this. Next slide. So after we learned of this, we decided to re-strategize the interventions which we were already having for nutrition for school-going children. So 3 main headings which we had. So what was the response? First response is what we call the health promotion, about which I will talk in the subsequent slide. Second is the disease prevention. So if you look at the huge incidence of anemia which is there in our country, we looked at a campaign which is called the T3 campaign, which is testing, treating and talking about anemia. So this is covering, and we have taken what is called the life cycle approach, which is looking at young children, adolescents, pregnant mothers, lactating mothers, women beyond the reproductive age group, and again as the young children. So we're looking at all the children, and in anemia especially we have interventions for children going to schools for 5 to 9 years and 10 to 19 years. So we are covering more than 250 million children in this campaign. Besides IFA supplementation, which is given, and children are tested for hemoglobin levels and discussed about healthy lifestyle, what is rich in anemia, how to prevent anemia. We also do biannual deworming, which is given twice a year in February and August, in which every pregnant woman is given this tablet, every school-going boy and girl is given, as well as out-of-school boys and girls are given. So it is a multi-sectoral, multi-ministerial intervention which takes place. Third is what we call the annual checkups under one program, which we call the RBSK, in which every child going to government and government-aided schools is given an annual checkup for 32 illnesses, diseases, deficiencies, and developmental delays once a year. This is a huge program in which we have more than 12,000 teams across the country which visit children in their schools and examine them and talk to them about the health issues which are currently present in their respective states. Next, we have what we call the Fortified Midday Meal, Fortified Midday Meal program, which is run by the Ministry of Education. So there is a lot of coordination between education and health. And this midday meal program runs from class 1 to 8. And now this year, under the new national education policy, we have also added the pre-primary classes, so that before the children start school, they visit what we call the Anganwadi Center, which is kind of a creche in which is managed by a different ministry. So supplementation will happen there also. So these are 3 ministries working together. And finally, of course, next slide, if we go, we talk about what is called the health promotion intervention, which we have developed. Next slide, please. Which you look at the school health and wellness program. This was a big mandate for our government, in which this is again a collaboration between Ministry of Health and Education, which is looking to increase the knowledge, positive attitudes and enhance life skills to promote informed, responsible, nutritious behavior among school-going children. We are covering more than 250 million school-going children in this across all the states. And we are developing these children as what we call the agents of change, because teachers are being trained in providing information regarding healthy behaviors, and these children will work as agents of change within their whole community and their own families. And besides just providing information, we are also building in linkages of the school children and teachers with the public nutrition system as well as public health systems. As of now, we have trained more than 100,000 school teachers across 22 of our 36 states. So this program is barely a year old, but we are so keen on implementing this using our school teachers that it is really working very well. Next slide, please.
Sorry to interrupt you, Dr. Zoya, but you also have 1 minute left.
Okay, yeah. Just to show that this IFA supplementation, if you just see the data which is seen for children 5 to 19, it showed a remarkable improvement in our IFA supplementation from 2018-19 to 19-20. There was almost a double coverage, if you can see, for 5 to 9 and almost 1.5 times coverage for 10 to 19. But sadly, with the coming of COVID, all our efforts have really taken a very big hit. The percentage coverage of IFA supplementation has gone down to less than half of what it was. But I think with the schools reopening, the Anganwadi Centers also reopening, where children go and get nutritious food, this is going to bounce back by the next year. Next slide, please. This is just what we generate every month. We generate these report cards in which, if you see the colors across the whole country nation, you'll have the yellow, green, and red. This shows a relative intervention supply of IFA tablets for all age groups. So this age group is right from 0 to 5 years, and then 5 to 9 years, as you can see in the chart, up to pregnant and lactating women. So if the darker the color, the redder it is, the worse the state is doing. So this is a very good ready reckoner for us. For all our review meetings, we use this for the states to, I think, to inform them, to create awareness that this color has to change from maroon to green. Next slide, please. Similarly, we also have a dashboard on which we regularly review with the states, and this is real-time data which we keep checking. The data entry is done right from the smallest category, which is called the block level in the country, and in the real-time basis every month we can see this data. As you can see in the data, just a lower graph, that there has been some stability, some increase in IFA supplementation across all the beneficiaries. This is data from 2018 up to July 2021. So there was increase now, but some stability, some fall has come, but we are hoping for an increase very soon. Next slide. Broadly, what lessons we have learned is that highest political commitment always works. You must set targets and review it with the highest level. We have the minister reviewing it very regularly. And as you have seen, that this interdepartmental partnership is something which really goes a very long way in keeping the program sustainable across a long period of time. You have to prioritize evidence-based interventions, which really help in supporting the interventions both in schools and out of schools. And also the public perception has to be constantly reminded as to how important nutrition is for all age groups, girls, boys, mothers, children, everybody. And a very important thing which we have come across and we emphasize as a country is that school is a wonderful platform to work to, and once you train the teachers and involve the girls and boys, they act as the best advocates to improve nutrition within their own families and within the communities. And of course, the financial norms is something which is very important. And lastly, the open-mindedness for corrective action. That is something which we pride ourselves in. We go with evidence, and anything which shows which can improve our program, we always change our programs so that the implementation is better and the outcomes are much better in nutrition for our own population, school children. Next slide. Yeah, that's it for me. Thank you so much. Thank you.
Thank you so much, Dr. Ziva. I really love this presentation. You sharing the length and breadth of this school health and nutrition program in India. It's huge, but then also the challenge is huge. You reminded us India is like the capital of non-communicable diseases. That's alarming. Thanks for sharing these lessons. And I think the dashboard specifically was very interesting. And I think it can serve as an example for many, many others and many other countries. Let's move from India to Brazil, the other part of the world. We have among us Dr. Patricia Grullon. She is the Nutrition Director of the Ministry of Public Health of, not Brazil, we are going to the Dominican Republic. Dr. Patricia, the floor is yours.
Bien, buenos días y buenas tardes para algunas regiones del mundo. Es un honor para mí, en representación de la República Dominicana, compartir el trabajo que hemos venido haciendo con relación a la educación alimentaria y nutricional. En este momento estoy yo aquí en representación del Ministerio de Salud, pero en el tema de educación alimentaria y nutricional es un trabajo que se hace en equipo, en coordinación obviamente con el Ministerio de Educación a través del Instituto Nacional de Bienestar Estudiantil, INABIE, que voy a estar mencionando durante la presentación. Primero, vamos a iniciar hablando de... ¿Por qué la necesidad de realizar un análisis de las capacidades de educación alimentaria y nutricional en las escuelas en la República Dominicana? Primero, es importante destacar que la demanda para integrar la educación alimentaria y nutricional en las escuelas ha incrementado en el país. Yo entiendo que todos los actores, tanto en el nivel gubernamental como en el nivel operativo, la población en sentido general, están sensibilizados con relación a la necesidad de contar con esta herramienta, con que esté integrada la educación alimentaria y nutricional a los sistemas educativos. Pero pese a los esfuerzos que se han venido haciendo en el país, como la implementación del Sistema Nacional de Vigilancia Alimentaria y Nutricional que se viene realizando en el país desde hace varios años, las guías alimentarias, que las tenemos desde el 2009 y que en los últimos años estamos trabajando en la actualización y en el enfoque por curso de vida que incluye la etapa preescolar, escolar y adolescentes, la capacitación del personal técnico que se viene haciendo, incluso con el apoyo de agencias como FAO, que año tras año viene apoyando este tema de la capacitación del recurso humano. Incluso todo lo que se ha venido realizando no ha sido suficiente para tener el resultado que todos esperamos. Entonces, sabemos que se requiere coordinar aún más los esfuerzos para que esta integración de la educación alimentaria y nutricional a nivel educativo se haga de manera articulada y que podamos tener los resultados esperados que aún no tenemos. Por ejemplo, sabemos que en los entornos escolares se incluyen tanto las comidas, la alimentación escolar, en el caso del sector público, la que es proveída por el gobierno, porque alrededor del 70% de los alumnos reciben una alimentación de parte del Estado a través del programa de alimentación escolar. También tenemos el tema de las cafeterías o kioscos donde se vende meriendas, snacks para los alumnos, los huertos escolares. Hay diferentes elementos que presentan oportunidades para favorecer la educación alimentaria y nutricional en las escuelas, que los niños y adolescentes se expongan a una educación para tener una alimentación saludable y lograr el cambio de estilo de vida que se quiere y que eso se vaya perpetuando en las diferentes etapas de la vida. Comenzamos en el nivel educativo y luego vamos evolucionando a las siguientes etapas de la vida. Por lo antes mencionado, entonces, se hace necesario poder contar con una mirada, con un análisis objetivo de cuál es la situación en los diferentes niveles y eso hace necesario el análisis de capacidades para lograr el cambio que requiere la República Dominicana. Siguiente. Entonces, ¿qué hicimos para el análisis de capacidades de educación alimentaria y nutricional en las escuelas en la República Dominicana? Bueno, primero participamos en un proceso donde se aplicó la nueva herramienta para el análisis de las capacidades elaborada por FAO. Como podemos ver en la diapositiva, no sé si pueden verlo.
¿Necesitas que el número de diapositivo?
El número 3.
Camila, number 3.
Gracias. Ahora sí, como podemos ver en la diapositiva, esta herramienta tiene como objetivo analizar no solamente las capacidades individuales de educación alimentaria y nutricional, sino también las capacidades a nivel de organizacional y los entornos favorables. Además, esta herramienta involucró varias actividades, incluyendo un mapeo de los diferentes actores relevantes. Como dije inicialmente, en República Dominicana es un trabajo de equipo donde participan varias instancias gubernamentales, el Ministerio de Salud a través de la División de Nutrición, el INAVIE a través del Ministerio de Educación, y también tenemos una especie de sombrilla, me gusta llamarle así, que es la Secretaría Técnica para la Soberanía y Seguridad Alimentaria, que une los esfuerzos de todas las dependencias del Ministerio, del Estado, perdón, para coordinar esos esfuerzos en torno a la garantía de soberanía y seguridad alimentaria, y eso incluye obviamente la alimentación escolar.
Disculpa, falta un minuto.
Perfecto. Además, esta herramienta involucró varias actividades. También participaron las agencias de cooperación, que son una pieza fundamental en el desarrollo de la educación alimentaria y nutricional en nuestro país, los diferentes niveles del sistema educativo, los maestros, los tomadores de decisiones, incluyendo los alumnos y padres de familia. Las universidades también participaron. Entonces, todos estos actores participaron en talleres virtuales participativos, valga la redundancia, y de esa manera se pudieron identificar las brechas, las oportunidades de mejora en cada nivel, y se propusieron diferentes soluciones a las mismas. Al final se lograron discutir entre todos los actores, y la conclusión fundamental fue la necesidad de que la educación alimentaria y nutricional en las escuelas se pudiera integrar mejor dentro de los programas de alimentación escolar que ya existen en el país, y otras intervenciones a nivel de los entornos alimentarios escolares, como son, por ejemplo, los huertos escolares que se vienen haciendo en algunas regiones del país. Siguiente. Finalmente, ¿qué se logró? Se logró disponer de esta hoja de ruta que permite identificar las acciones, y no solamente las acciones necesarias, sino también los responsables de cada una de estas acciones en los diferentes niveles. Esta intervención fue muy importante porque permitió que una mirada externa pudiera ver lo que cada uno de nosotros en nuestro espacio de trabajo no conocemos, nuestra área específica, pero de manera externa se pudo ver de forma objetiva cuáles eran las necesidades, y al final se pudo llegar a un consenso de cuáles serían las soluciones para cada una de esas brechas identificadas, y a partir de ahora simplemente queda iniciar el trabajo. Muchas gracias.
Muchas gracias a ti, Patricia. Thank you so much. I really, again, love this presentation, highlighting the role of school-based food and nutrition education in improving eating practices, but also the role of the school food environments that they can play in enhancing nutrition education. I'm sure everyone online will like to use your approach and contextualize your approach in their own setting. So thank you so much. And I already promised you to move to Brazil, so let's do that now. We have a video presentation from Ms. Karine Silva dos Santos, who is the General Coordinator of the National School Feeding Program in Brazil. So that's a video.
Olá, tudo bem? Meu nome é Karine Santos, eu sou coordenadora do Programa Nacional da Alimentação Escolar aqui no Brasil, e a gente vai conversar um pouquinho sobre essa política tão importante, né? Vou trazer um pouquinho da experiência brasileira para vocês. Bom, o Programa Nacional da Alimentação Escolar, o PNAE, como é conhecido aqui no Brasil, é uma política hoje, uma política de Estado, é uma política estruturante, né? E que tem vários marcos legais aí ao longo dos seus mais de 60 anos de existência. Hoje o programa tem 65 anos, né? e consta já como uma política obrigatória na nossa Constituição Federal de 88. Então, o PENAI ele aparece como um programa suplementar à educação, assim como outras políticas desenvolvidas, como a política do transporte escolar, a política do livro didático, né, do material e do livro didático, que são políticas suplementares à educação. É importante a gente entender, né, que esse caráter suplementar é porque necessariamente há uma participação para a execução, né, dessa ação do nível do governo federal, estadual e municipal. Eu vou falar um pouquinho sobre isso. Então, quais são assim os grandes números, né, que a gente tem em termos de execução da alimentação escolar no Brasil? Primeiramente, a gente faz um atendimento que é um atendimento universal. O que isso quer dizer? Todas as crianças da rede pública, desde a creche, pré-escola, ensino médio, já os adolescentes, enfim, educação de jovens e adultos, todos os nossos alunos, todas as crianças matriculadas na rede pública do Brasil, então, recebem alimentação escolar. São, computados para recebimento da alimentação escolar. A gente atende hoje 41 milhões de estudantes. Isso quer dizer que a alimentação escolar ela está presente nos nossos 5.570 municípios, mais nos 26 estados e no Distrito Federal. Então, por dia, a gente chega a ofertar mais de 50 milhões de refeições, né? A gente tem no Brasil, são 150 mil escolas. Então, os números são realmente muito impactantes. Mas a gente se pergunta como é que a gente consegue, né, executar isso em toda a territorialidade do Brasil. A gente só consegue fazer essa execução porque a política ela é uma política feita em regime de colaboração. Então, o governo federal faz os repasses em função do número de alunos existentes, matriculados naquela rede de ensino, seja ela estadual ou municipal. É o governo federal quem dita, né, quem traz as orientações e diretrizes para a execução dessa política, e os municípios e estados executam, ofertando, né, de fato, a alimentação para os nossos estudantes. Então, esse regime de colaboração nos dá a possibilidade, então, de estar em todos os lugares do Brasil, né? Além da importância do regime de colaboração, é bom dizer também que dentro das nossas diretrizes, nós temos também a questão da participação social. E a participação social, aqui, para receber o recurso da alimentação escolar, cada entidade, cada município, cada estado, precisa constituir o seu conselho de alimentação escolar. E por que eu quero dar destaque a isso? Porque é o conselho quem acompanha, fiscaliza, faz esse monitoramento, né, de execução. Esse conselho ele é composto principalmente, né, pelos pais dos estudantes, pelos próprios estudantes, pelos coordenadores pedagógicos, pelos agricultores que fornecem para a alimentação escolar. Então, é uma composição de participação, né, com membros da comunidade escolar para acompanhar a execução dessa política. E dentro das nossas diretrizes, então, eu queria citar algumas coisas que eu considero bem importante para vocês, que é a alimentação escolar, ela vem no eixo da segurança alimentar e nutricional e está pautada no direito humano à alimentação adequada e saudável. Isso é um grande ganho, porque não basta apenas ofertar, né? Então, a gente tem o eixo de oferta, mas tem também o eixo da qualidade do que se oferta. Então, estar, né, e garantir a alimentação como direito humano para toda a comunidade escolar é algo muito importante. Além dessa diretriz do direito humano, a gente também preconiza a educação alimentar e nutricional. Então, oferta, qualidade e formação de hábitos alimentares mais saudáveis, né? Esses seriam mais uma diretriz do programa. A educação alimentar e nutricional, necessariamente, ela precisa ser realizada, né, pela nutricionista responsável técnico pelo programa, que está em todas as entidades executoras, né, em todas as instituições, em termos de nos níveis municipais e estaduais, e precisa contar com a participação dos atores dessa comunidade, né, os próprios professores, os coordenadores pedagógicos. O interessante é perceber o espaço escolar, né, o ambiente escolar, como um espaço propício para a formação de hábitos alimentares mais saudáveis, principalmente, né, nos primeiros anos da escola, né, na educação infantil, no ensino fundamental, nos anos iniciais, entendendo que uma vez que a gente consegue, né, estimular e formar hábitos, isso vai persistir por toda a vida daquele indivíduo. Uma outra diretriz que a gente tem dentro da alimentação escolar, né, como eu disse, é a universalidade do atendimento. Então, não há que se falar em atendimento apenas para vulneráveis ou atendimento apenas para algumas regiões do Brasil, em função de dificuldade socioeconômica. Isso não é caracterizado, né? O que a gente faz é um atendimento universal. Uma outra diretriz também muito importante é a questão da agricultura familiar. A nossa lei, eu vou falar um pouquinho dela daqui a pouco, ela trouxe grandes marcos e inovações, né? Dentre eles, a obrigatoriedade de que pelo menos 30% dos recursos do governo federal fossem destinados ao pequeno agricultor. E qual é a intenção disso, né? Qual é a indução que essa política faz? Primeiro, de fato, é conseguir ofertar alimentos mais saudáveis. Então, alimentos in natura e minimamente processados. Frutas, verduras, hortaliças, né? Que o pequeno agricultor produz na sua grande maioria. E segundo, além dessa oferta mais saudável, né? É também ter e conseguir, né? Fazer um desenvolvimento local da economia. Então, há uma produção e venda naquela localidade, né? A gente estimula os circuitos curtos de produção, esse alimento ele chega mais rápido até a escola, chega livre de agrotóxico, porque a plantação, né, a produção é feita numa escala muito menor. Então, a agricultura familiar tem sido essencial para que a gente possa garantir alimentos mais saudáveis no ambiente escolar. Uma outra questão que a agricultura familiar traz de maneira muito impactante é a questão da diversidade dos alimentos, né? Então, no Brasil nós temos alimentos típicos das regiões e das várias regiões que temos aqui. E o que a gente come, por exemplo, de café da manhã do norte, que poderia ser um açaí, não é o que a gente comeria na região sul do Brasil, né? Ou na região nordeste, que utiliza muito alimento à base de milhos, né? Então, a diversidade cultural alimentar, ela fica muito evidente na produção da agricultura familiar. Bom, e para finalizar, eu queria só dar destaque sobre a importância da instituição, da implementação, né, da publicação de leis de alimentação escolar. É muito importante que a gente consiga garantir, né, que os países tenham as suas leis, porque a partir da lei a gente consegue garantir, né, a definição de papéis de cada um dos atores envolvidos nesse processo da alimentação escolar, consegue garantir orçamento, né, para a execução dessa política. Então, é muito importante que a gente consiga defender e garantir a implementação de leis nesse sentido. O Brasil está à disposição, a gente segue, né, nesse compromisso de fomentar e contribuir nesse diálogo sobre a alimentação escolar. Até logo.
Thanks so much. I cannot thank you in person, of course, but I think this presentation was again brilliant, combining basically everything. But specifically, I'd like to highlight that it is important to remind ourselves always of human rights, the right to food, as was put forward so eloquently by this last speaker. And then the right to food, of course, is also one of the principles, human right-based principles, is participation. And that was so nicely put forward in this program through that social participation and participation of I would say, the agents of change in the school setting. So I think that really made that circle round again. Right-based approaches, social participation, and then linking to collaboration and multi-sectoral approaches, including the agriculture sector, and emphasizing dietary quality. So great. We have a bit of time for a Q&A session. So I've seen that you've been very active in asking your questions in the Q&A box. I have seen a few of those questions have been answered, but still I spotted one for Ghana, for Essie. So Essie, if you agree to answer this question, it is about the Ghana setting, of course. Can you share some of the strategies your government is using to monitor the implementation of these interventions? And could you also say something about what elements are key to ensure program sustainability?
Right. Thank you very much.
The floor is yours.
So the question is on how to ensure sustainability of this program. Right.
And sustainability and also the monitoring of the implementation.
Right, thank you. The monitoring is integrated into existing monitoring system of the Ghana Health Service and to some extent the Ghana Education Service. So recording of activities is done at the school level as the primary source of data, which is then collated and picked as part of the monitoring system by school health agents who are actually the Ghana Education Services staff. And then this is linked up with the Ghana Health Service existing data capturing system, which is then collated and sent across to the relevant points for decision making and revision of strategies. On sustainability, I would say that partnership is really key, and bringing all the key partners to the table at the onset of the program implementation generates the needed interest ownership for partners to be part of the process right from the beginning, and if you like, make it part of what they do. And that has been one of the key points. Of course, evidence generation on what actually works, the how of reaching the school age child is also important to ensure that this is scaled up. Thank you, over.
Thank you so much, Esi. In fact, I also saw another question for Dr. Rizvi from India. Can you tell us if there's been any program performance evaluation done to understand the impact of midday meal programming on micronutrient profile of school-age children in India?
Yes, I read that question and I had sent a reply that the midday meal program is a part of Ministry of Education. So they hold these regular impact studies, but these are primarily, since India is a huge country, most of these impact assessments are done by the state level only. And I've in fact shared a link to a couple of studies which were there, done for the state of Odisha, done for another state. So those are done. But however, if you look at broadly speaking, because I'm from the Ministry of Health, so if you look at broadly from what the health perceives is that it increases, the midday meal increases the school attendance because children get to sit together and eat. That has been shown. Increases the intake of IFA tablets also because children are given IFA tablets along with the midday meal. So there's a system in place. And thirdly, even deworming, the giving of albendazole tablet also is more systematic while midday meal is being given. So fourthly, in fact, some states have gone ahead and even distribution of sanitary napkins is done along with midday meals. So the record keeping becomes kind of easier, So one person who's giving food is also keeping record of the other commodities. So that way the partnership between health and education and reporting becomes easier. So that I would say from the health perspective, it is working very well. And in fact, with the new, we have a right to education in which every child has to attend schools up to class 8. So all children at least up to class 8 are attending schools and they've been giving free nutritious meals. In fact, even during COVID lockdown, I'll be happy to share that even though the schools were closed, but there was home delivery of this nutritious food rations, what is called, was delivered to homes so that the children do not suffer from malnutrition. But yet there have been reports, yes, all the children did not get because of teachers were not available or the distribution system was not really functioning because distribution system was kind of diverted for management of COVID cases. So that has happened, but broadly, yes, that coverage of distribution of nutrition has happened even during lockdown. But assessment, I'm sorry, I really cannot inform you about the latest because I'll have to share with the Ministry of Education what they have done. I'll find out.
Yeah, no worries about that. But thank you. This was already very helpful. I also spotted a question that's basically for all of you, but I'd like to ask it to Patricia first. This webinar, this event is about school-based intervention and school-based policy programming. But the person would like to know if you would have any experience on how you work to reach out of school children and adolescents with nutrition programming and policies. Patricia, could you share some thoughts with us? I think she's waiting for translation, maybe. Patricia, ¿has entendido la pregunta? If not, Patricia, can you hear us? Did you hear the question?
Yeah.
Did you hear the question, Patricia?
No, I'm sorry.
I will repeat slowly.
Thank you.
So this webinar is about school-based policies and programs, but we wonder if you or maybe any of the other presenters have any experiences on how you could work to reach out of school children and adolescents with nutrition programming and policies. If I put you on the spot, I can also go to another panelist to ask this question.
Si es posible, voy a responder en español. Si mal no entendí, la pregunta es, ¿de qué manera se pueden alcanzar los estudiantes o los niños para la educación alimentaria y nutricional?
Fuera de escuela.
Fuera de la escuela. Bueno, entonces esa sería básicamente nuestra zona de confort, porque como trabajamos en el Ministerio de Salud, desde el Ministerio de Salud entendemos que uno de los principales escenarios donde se pueden captar a los niños y adolescentes son las unidades de atención primaria de salud, porque frecuentemente los niños, o sea, hablando fuera del entorno educativo, frecuentemente los niños son llevados a buscar atención de salud, ya sea a citas regulares, por ejemplo, para inmunizaciones. Esas visitas se pueden convertir en una oportunidad para mejorar la educación alimentaria y nutricional. También ya hoy en día sabemos que la tecnología de la información forma parte del día a día en todas las edades, entonces también se podría aprovechar esa herramienta como manera de llevar la información sobre educación alimentaria y nutricional. Entiendo que esas serían las principales maneras de captar estas poblaciones fuera del entorno educativo.
Perfecto, muchas gracias. I wonder if maybe Dr. Rizvi would also like to add a few words there.
Yeah, I was in fact typing my answer. That is again reply to that only. Is that in India we have a structure within the Ministry of Women and Child Development, which is called the Anganwadi Centers. So these are community-based small centers in which the lady who's posted there, she's called an Anganwadi worker, AWW. So she has a data information about whichever children are not going to school. So that information is collated every 1 year. She updates the information and she has the information. So whenever we have any campaign for out of school children, she's a very good information center for giving us the information, how many children and how to even for any distribution of nutrition. She's the one who's in charge. In fact, she gives information about pregnant mothers, about girls out of school. So all the information for distribution of whether it is IFA tablets, whether it is food, whether it is deworming, napkins, whatever has to go through her. So that is one system in place by the government. Other system which I was also mentioning is the non-governmental organization, the NGOs. We have a huge set of NGOs in India which work with the out of school girls and boys as a part of the whole programmatic intervention. So a lot of our partnerships for adolescent health also works through NGOs. And we have a huge network for even in the adolescent health program, a lot of our interventions are working through NGOs in the field, which have a good network and the penetration. And I think service provision is done through these NGOs also.
Thanks. Excellent. Very interesting. I'd like to ask the three of you one last key remark before we move on to the second part of the next part of this webinar. So the three of you have given us wonderful and very in-depth insights in the work you're doing. You've been sharing very good examples of the work, the school-based work you've been doing. So I'd like to hear from all of you, maybe a 1 minute or half a minute even sentence statement. What is your key takeaway? What is your call for action to governments? What would you like governments to ask, to commit for in this area of work? So I don't know who would like to start. Just one sentence. What is your key takeaway? What is your main call for, main key message to countries to improve nutrition of school-age children? What should be committed? Izzy, you like to start?
Yeah, sure. Thank you. For us in Ghana, learning from what we've done to date, we think that what was really the turning point to get commitment from stakeholders and also government was the fact that right at the beginning we could generate the evidence that proved that investing in the adolescent actually works. And right at the beginning, when we did a baseline and a quick follow-on, we showed that just under 1 year of supplementation reduced anemia by as much as 26%. And was really a turning point. And that was invested into the advocacy that was making the case that when you put in money into this, not only does it work, you are getting the triple benefit of investing in their lives today. And the government is actively pushing a free secondary school education. So it was to, we built on that, or rather took advantage of that and say, here, for your investment in education to happen, you need to look at the nutrition space and make a difference in their health and development. And for us, that was the turning point, and would like the government to do more of strengthening this program by way of generating more evidence on what really works for others to run with it. Thank you. Over.
Great, the evidence is there, data work, investment pays off. Excellent. Dr. Rizvi, for you, 30
Yes,
minutes,
okay.
30 seconds.
No, yeah, I'll speak less than that because Essie has spoken everything I was thinking of. So I will not repeat. But I would only say that whenever you're planning a program for school-going children, there has to be co-ownership of health and education. It should not be health money or education money. So whenever planning is done, you plan together, you sit together for planning. Before the program is rolled out, that ownership should be there. And that, thankfully, we have managed in our country with the School Health and Wellness Program. And I'm seeing this beautiful partnership coming because whenever we have review meetings, both of us sit together. And any changes which we are looking on, even though it is suggested by health, the ownership is there of education. So that is the kind of, I think, working in tandem which has to be there so that any intervention from one end reaches the other and owned up completely by that. So
Excellent.
that I think is the thing, yeah.
Perfect. Co-ownership, participation, collaboration. Very good. Patricia.
En el caso de la República Dominicana, primero, el ejercicio que mostramos fue clave para entender cuáles eran las brechas de forma integral y objetiva y establecer posibles soluciones. Yo entiendo que primero sería el trabajo integrado entre los diferentes actores del país que trabajan el tema de educación alimentaria y nutricional. El marco legislativo es muy importante, contar con un marco legal que favorezca la inversión, como ya mencionaron, en educación alimentaria y nutricional, y sobre todo integrar también a las universidades, las escuelas, o sea, incluir el tema de educación alimentaria y nutricional de manera formal en la currícula educativa, que sea coherente con las guías alimentarias del país. O sea, que no sea que el Ministerio de Educación decida de manera aislada integrar algunos temas, como por ejemplo ocurre en este momento, sino que de manera formal se trabaje en conjunto esa currícula para las escuelas.
Thank you so much. So that integrated work we have now, data, collaboration, cross-sectoral work. Perfect, thank you. Lovely panel, thank you so much. So let's move on. We have been speaking about cross-sectoral collaboration. We have been speaking about collaboration. We have been speaking about bringing people to the table. And in fact, we are speaking about young people. So let's speak with two young people now. I'm very pleased that we have Jane Napais with us, who is a committed youth advocate and team lead for the Feed Nutrition Advocacy Unit. She is advocating for adolescent girls' nutrition. Jane, can I please ask you a question? I would like to know from you how young people can drive the nutrition agenda and how country governments can involve and engage meaningfully with you, young people, to ensure healthy, nutritious, and safe diets. Thank you, Jane. Over to you.
Thank you so much. It's a great opportunity to be here. Maybe to start off to highlight is that the young people, particularly the adolescents, they are the missing link in the fight against malnutrition. And also the adolescent is the second window of opportunity for better growth and development. And that with good nutrition, this group is given the chance to be able to reach their full potential and also it creates this opportunity to cut off the intergeneration cycle of malnutrition. To answer your question, how young people can drive the nutrition agenda, most importantly is the need for safe space to express themselves and their opinions. What I mean is that the moment this adolescent gets the chance to be able to have this platform so that in case of any nutrition challenges they have, they can be able to share. And knowing that there is a way a young person can speak freely to the same young person as compared to speaking to an older person. So I feel like there's need for safe space for them. And also in terms of nutrition advocacy, we need to note that the language that we use during this advocacy, it should be simple so that it can be easy for them to be able to understand the concept. Sorry?
Are we going to eliminate IDD from our country?
Can people please mute their microphone when not speaking? Please continue, Jane.
Okay, thank you. Like I've mentioned, the issue of language, for the advocacy it should be simple for them so that they can be able to understand, as much as we are trying to address the nutrition agenda for the school-based and also the adolescent. And also learning from past success and mistake, maybe to share from my work as a youth leader for nutrition. I'm running a campaign scaling up adolescent nutrition in Kenya. So you find that the moment you bring these adolescents together, there is a way, the moment they share their past, for instance, the mistakes that they made as youths. So the moment they come together and share their views on the best ways they were able to overcome, I think this is the best way in terms of how they practice good nutrition and whether it's bad nutrition practices or good nutrition practices. So it's a best way to be able to learn how to practice good nutrition and to learn from each other. And as we are trying to put the nutrition agenda, especially for the school-based and also for the adolescent, we need to make sure that they participate in setting these goals and objectives, because at the end of the day, the change that we want to make for us, for young people, we need to be involved in making these objectives, because setting these things, if it doesn't work for us, I feel like the government will spend so much resources to work on something that maybe it was not meant for them. So it is good that the best way to be able to drive this nutrition agenda with them is to ensure that they're able to set these goals for themselves and also the objective. Also, working out the barriers they face as youth is also important, because from this, they can know that what barrier is driving me for not to practice, for instance, good nutrition. For adolescent or school going, what is the best way to be able to avoid the issue of school dropout? So for me, I feel like it is good to be able to create the safe space for these people to be able to share their views on nutrition, and also, as we're trying to address the issue of malnutrition, bringing them together to share their views is the best way, so that they can be able to go in the same direction as youths, as governments, and all other stakeholders. To go on how
maybe you should wrap up, because we are a bit short on time. Thanks.
Okay, just to wrap up on how the government can engage meaningfully with young people, is that there should be that open workshop and training for these young people to practice good nutrition. And also in terms of law policy making process, they should be involved. And also creating these youth-friendly services where the adolescent can share their needs, they're being able to be treated respectfully with the healthcare workers. And also there is the issue of discrimination and stigma is being controlled in that situation. And maybe I can just say one point.
Word. Yes.
Yeah, one word. There's this important document that Save the Children have been able to work on, and it has addressed the model commitments that the government can make, and it's investing in the now and the future. And I'll be happy to share the link with the rest of the audience, because it can work in any country, and it's a good way to be able to address the issue of adolescent rights to health and nutrition. Thank you so much.
Thank you so much. I mean, that safe space is key. And you put out you explained very carefully how that should be done. And I really liked how you started off by bringing us back, in fact, also to what Lynette said, the opportunities, the good reasons why working with adolescents is so important, and using the appropriate language as well. That was not something mentioned by Lynette. So thank you so much. Let's move to the final speaker, Dr. Lisbeth Steer, who is the director of the Education Commission. Lisbeth, we are all advocating for nutrition through the education system, but it would be great to hear from you about why countries need to invest and commit to improving the health and nutrition of children in the school age years. How do you see that happen? What should we do? Over to you.
Thank you. It's really wonderful to hear this conversation. It's inspiring. I hope you can hear me well. Thank you, Stineke, for such great chairmanship as well. I think I just would like to make 3 points, and I think they are somewhat summarizing what people have been saying so well over the last hour or so. So 3 things we need to do. 1, we need to create a common and irresistible narrative that's based on evidence, as many of you have noted. If we are the first generation in history that wants to end poverty and equip every child and young person with the education and skills they need to be productive adults, we must deliver on the most important safety net for children, and that is health and nutrition in schools. There's been a lot of emphasis on the first 1,000 years, the early childhood, but we all know, and it's been emphasized, that sustaining these gains requires us all to continue supporting children and young people through the next 7,000 days that follow in the years. The evidence of the importance for education and children's opportunity is clear. Healthy children do not only participate more in school, but they also learn more. And you know this all well, you've mentioned it, interventions addressing worms and anemia could lead to 2.5 years of additional schooling. Nutritious school meals increase enrollment rates, increase participation and attendance. And in low and middle income countries, every dollar invested in school feeding yields $9 back in social returns as children become much more productive adults. So that narrative is really important. And the narrative also includes saying that in January 2020, before the pandemic hit, we were doing really well. School health and nutrition programs had created this extensive safety net. 1 in 2 of the world's children received a meal at school, for example. And in Africa, that had grown to by 70%. And many of these programs were funded by nations themselves, by domestic resources. And they included essential health services such as deworming and nutrition. But as you all noted, what happened in April 2020 is a disaster. The closure of schools has been a disaster for the world's children. More than 1.5 billion children were immediately shut out of school. 370 million lost access to this one meal of a day that they had. And so we had this incredible shock to the system, and that narrative, we need to get it through there, through in the sort of busy space of international cooperation. So as countries build back their systems, we must include this critical health and nutrition support. So our narrative is important. Secondly, you all said it much better than I can. We need to work together in new ways to build coalitions for change. We are telling our story, and we need to address the challenges in a way that brings sectors together: health, nutrition, agriculture, education. We heard these fantastic examples from Ghana, India, the Dominican Republic, Brazil, Kenya, inspiring. I also wanted to flag an important global initiative that was launched in September at the Food Systems Summit, where member states, a group of member states, formed the Global School Meals Coalition with 60 countries and 50 partners who committed to this coalition. WHO, UNICEF, UN Nutrition are all members and closely coordinating with WFP, who's been putting this also together with all of you. It's an example of UN collaboration that was marked by the UN Secretary General as really inspiring. So we think kind of that is an example of working together, and we can build on it from school meals to nutrition to health. This is a starting point. This coalition wants to restore some of what has been lost during the pandemic, and it wants to also expand to those who haven't been reached so far. And then thirdly, after we have built these coalitions together, we need to address key bottlenecks. And one of these key bottlenecks that we think a lot about at the Global Education Commission is finance. Financing is critical to this because school meals are not free. School health and nutrition is not something you can get for free, and we need to put resources into it. Estimates are out there that this could be $5 billion in low-income countries alone. We know that this cannot be done and mobilized in conventional ways. We must enhance the effectiveness of existing investments, find innovative solutions, and also put transitional mechanisms in place to help countries become self-reliant. That's why under the coalition, we created a multi-sectoral financing task force for school health and nutrition under the Global Education Forum. And I really would like everybody to help us with this, to try and find ways to put the finance behind this important agenda that we have been discussing.
Yeah.
So that is, there's
Thanks
also work being done under the research consortium, which you, under this coalition, which you can look at. So Thank you very much on behalf of the UN Special Envoy for Global Education, Gordon Brown, who's very supportive of the work that you all are doing. And we are committed to be a partner and help with all of this.
Thank you so much. This was really a strong call to action. I really liked it, how you moved it from the UN Food System Summit towards Nutrition for Growth, with mentioning that need to work together, first to set that narrative, then the important coalition work. And thank you for highlighting that school meal coalition as a very nice example of us all working together. So excellent, thank you so much. So now we are heading towards Nutrition for Growth, and it is indeed time to set these bold commitments towards making sure that that school meals are healthy, but not just healthy, but that also the entire school environment, and that schools can function as a system to improve nutrition. So let's set these bold commitments. You know that I'm the Executive Secretary of UN Nutrition, and I am really looking forward to follow this work. But I would like also to highlight, as was done also by Lisbeth Steer already, the strong UN community we already have that is working in this space on school food and nutrition, supporting countries in developing, implementing and monitoring comprehensive school food and nutrition policies. Maybe we can quickly see that slide, about the work we did last year with the community of practice on school nutrition that has members from among a large group of UN agencies, but also beyond the UN, obviously WHO and UNICEF are among them. We put together a compendium or a repository of key documents from the UN agencies and these key partners. They are pasted here on the sheet, on the slide. Of course, there's not even space to put all of them, but just to give you a flavor of what is out there. And thank you for pasting the link in the chat. So that slide, there is this wealth of resources that is addressing the different aspects of designing and implementing school food and nutrition policies and programs. And that helps us to develop policies, practical tools for designing nutrition education activities, but also guidelines for nutrition-related school health interventions, and also tools for monitoring and evaluating the effect of these programs. I hope that this slide, and of course the documents that are out there, help to inspire you all to pick up and accelerate this important work. And with that, I would like to formally close this session. So I hope with this inspiration, you all leave with a smile. First of all, before we close and we leave, I would like to thank all of our speakers, all of our panelists, but also, of course, the interpreters and you, the participants and the audience, for joining us and discussing this major issue we face within wasting, breastfeeding, complementary feeding, micronutrients, fiscal policies, finance challenges, labeling, marketing, and school food and nutrition policies and programs. Again, this was the last session over during this week. We have heard from countries about their best practices, journeys, and solutions in tackling all these issues. So again, this was the final session of our UNICEF WHO Nutrition for Growth Health Week. This session, as said, has been recorded. So if it will be available later on, and of course we also hope you will bring the rich knowledge shared to your respective countries, and of course we hope to encourage you to do smart commitments at the Nutrition for Growth. These webinars, the webinars of this week, they are the official side events of Nutrition for Growth. The recordings, as said, they will be available in English, in French, in Spanish, Arabic, and Russian for the 8 webinars that were held today and earlier this week. Soon the recordings will be uploaded to the website as posted in the chat. So again, I wish you a lovely rest of the day, or maybe you would like to go to sleep now, or maybe you're just starting your day. whatever the situation, I wish you a lovely day or night, and I hope to see you again. And I encourage you to do smart commitments for the Nutrition for Growth. Thank you. The session is closed.
Thank you.